And now we say good day to my colleague Mel Camp. Mel Camp has been a very busy reporter in the last few days. Today, I know that she's going to be showing us a few people who are featured on today's show. Hello, Mel. Welcome.
Oh, good morning, Linda. Yeah, I spoke with Commissioner of Health, Dr. Burstein, and got some information on COVID-19 testing here in Erie County. Take a look at this.
Dr. Burstein, thank you so much for joining us on AM Buffalo. If I were you, I'd be absolutely exhausted right now. What's your secret? How are you keeping up with all of the craziness right now?
I have a lot of support. There's a lot to do. Days are very busy, go by fast, come home, I'm exhausted. I mean, some of the decisions that we have to make and the programs that we have to plan are very, very important for our community. So, that keeps me going.
Are there things that we can do if we haven't got this virus to make sure we don't get it, or if we do get it, we could hopefully fight it?
There are things that we can definitely do to prevent exposure, which is really, the primary prevention, right? Because we won't ever have to see it to fight it. So that really entails social distancing. So, going to the grocery store, of course, you're going to run into other people at the grocery store. So that's wearing a mask is really important. Also, washing your hands. And then if you don't have access to that, use a good EPA-approved some type of hand sanitizer.
So that's all information that seems to be constant in the ups and downs of what to do or not to do. It's like wear a mask, social distance, hand sanitizer, wash your hands. Like that
right. Stay away from the people that are sick. And then, if you have symptoms of COVID-19, you can talk to your healthcare provider about whether you should have a test or not. Now, right now in our community, we're so fortunate that we have good availability of testing. So right now we are testing anybody that has symptoms that could be consistent with COVID-19, which are pretty broad, any type of like virusy feelings. You can talk to your healthcare provider whether testing is right for you. Just people have to understand that when somebody commits to getting testing at the time of specimen collection, that they are in isolation, and that's a commissioner's order. That's actually a legal order, and there could be consequences for breaking it.
What's the difference between the COVID-19 test and the antibody test?
Well, the diagnostic COVID-19 test, so that will tell you if you have an active infection now. It's a molecular diagnostic test. So it's looking for DNA of the COVID-19 in a person's respiratory tract, and then that will tell you if you have active virus in your body. And right now, most of the tests are collected by a swab in the nose. An antibody test is different. So that's a blood test. And that is telling you that sometime you have been exposed to COVID-19, you're probably infected, and your body mounted an antibody response. We have the experience that if we have antibodies, that they're protective and they will protect us from recurrent infections. And I know for many infections that's true. However, that's not true for every infection. I mean, how many people out there have had a strep throat more than once, right? I know that, we were hoping that, enough people get infected in our community, we can reach like the herd immunity standpoint. And, we can't say that at this point. I mean, really the time when we can say that we're more really protected is a time when COVID-19 is a vaccine preventable disease. And so, again, this is the new normal now. And, unfortunately, this is what we have to go with until we can get a vaccine.
Another question that was put to us on Facebook was how much are the tests going to cost? And Dr. Burstein said that she couldn't say exactly because it depends on your healthcare provider, it depends on your healthcare and also where you go for the testing. So the best thing to do is to contact your healthcare provider if you think you need testing for COVID-19. She will be back tomorrow. Dr. Burstein will be answering some of our Facebook questions, so tune in for that.